to Aseem.
That sounds good.
How's it going?
I'm good, thank you. How are you?
Yeah, all good, all good. Now, before we start getting into the nitty-gritty, I just wanted to present you, firstly, with a Smash the Fat polo t-shirt. So there you go.
Thank you, Sam.
And also for being a Smash the Fat ambassador, you get all of our wristbands, which is novice, beginner, intermediate, and finally advanced. So essentially, you're a black belt.
Wow.
In
Thank
Smash
you.
the Fat, which is awesome. Yeah, I appreciate that.
Very kind.
And thank you so much for coming here today and for supporting everything that we do as well. So first things first, why should we listen to you?
Well, that's a very good question. My main job, my role, is I'm a cardiologist, and I look after people who have heart disease. You know, my day-to-day, my life is really involves everything to do with those patients that come in, and certainly we have a real problem at the moment with a public health crisis with obesity and its related diseases, and it's something that I feel as a doctor. I have a duty to my individual patients, but also to the wider population. And part of what I've been doing over the last couple of years is trying to look into and analyse really why did we get to this state, what are the factors that have been involved, and there are lots of factors, the food environment being one of them. But one of them is also around dietary advice and the way the industry has taken advantage of conventional dietary dogma. And how that has contributed to the problem of obesity that we face today.
Absolutely. Yeah, it's really worrying for us as a company that our major definite purpose is to help as many people as possible obtain and maintain a healthy lifestyle.
Absolutely.
And it doesn't help that the current conventional wisdom isn't exactly ideal. So, firstly, what are your sort of pet peeves with the current?
So one of the things that really started to concern me and I started looking into is first of all, we know from America, Robert Lustig, a pediatrician at the University of California, San Francisco, has kind of highlighted very effectively the dangers of sugar, and we know lots of studies, and we can talk about that later, about the fact that our consumption of sugar has increased. It's additional calories at the very least. There's no nutritional benefit from sugar. But how the industry have really added sugar to a lot of foods, processed foods. One of the obvious factors that has been imprinted in the obesity epidemic is the consumption of processed food, which has increased dramatically. And one thing that really concerns me is the heavy promotion and marketing of foods as low fat. Which actually are loaded full of sugar. There are several things you will find within supermarkets and department stores that have really obscene amounts of sugar that are marketed as low fat. So even people who want to so-called lead healthier lifestyles actually are being misled. And the argument against looking at nutritional labelling is the fact that most people's purchasing is based upon the way the product is promoted, not its nutritional content. And that's something that really concerns me.